It is just a huge honor for me today to be podcast interviewing Jarod Johnson, a board-certified pediatric dentist in Iowa. We had him 2 years ago, November 15th, November 2015. He was episode 221. And I wanted to bring him back because I think what he's doing is amazing. He's Arctic Dental owned and managed by Dr. Jarod Johnson. Dr. Jarod has received advanced training in behavior management, sedation, hospital dentistry, trauma, special healthcare needs, interceptive orthodontics, space maintainers, oral hygiene, and dietary consulting. He enjoys educating children and their families on the importance of oral health so they can establish good habits for a lifetime of smiles. His goal is to develop relationships with each of his patients to establish a dental home that is welcoming from infancy through adolescence. He earned his dental degree, Bachelor of Science in Biomedical Engineering, University of Iowa, Doctor of Dental Surgery, University of Iowa, where he is sitting right now next to Deb Hoyle, who's the Iowa Practice Opportunities Coordinator. And she's been doing it for 11 years. That's amazing. In 2006, the University of Iowa College of Dentistry and Dental Clinics received a grant from Delta Dental of Iowa, and that's the lady to the right, Maren Lenhart, and to start the Office of Iowa Practice Opportunities and hire a full-time Iowa Practice Opportunities coordinator. A coordinator was hired in January 2007 to manage the office and facilitate communication between students, dentists, and communities. The Office of Iowa Practice Opportunities, OIPO, has become an integral component in recruiting and retaining dentists in the state of Iowa. It is the first place many students go to when they are beginning the process of deciding what to do after graduation. Since its inception, the OIPO has helped facilitate 173 placements, with 78 of those placements in rural Iowa communities. That is so amazing. And then we have Maren Lenhart, and she's in Johnston, Iowa, a suburb of Des Moines. And she's going to talk about how Delta Dental has got involved with this. You know, it's so sad that there's 323 million Americans, and half of them live in 147 metros, and the other half live in 19,008 towns. But 2/3 of the dentists go to the urban where only half the people are. And I was born and raised in Wichita, Kansas. There's several cities out in the rural areas of 2, 3, 4,000 people that don't have one dentist. If all the dentists would evenly spread out, it would be so much better for everyone. I mean, you're never going to go see 11 Burger Kings on one corner. I mean, they spread out, 3 miles apart. But the dentists, my God, you can find medical dental buildings in Phoenix that have 20 dentists in one building. There's a dental office in downtown San Francisco. How many's in that building? Do you remember? Oh, it's like 100 and I think it's the craziest corner. I think it's on Sutton Street. It's like 120 dentists in one building. And then on the way to Reno or Lake Tahoe, you'll drive through towns of 2,000 and 3,000 that don't even have a dentist. So thanks for coming on the show. Who wants to start talking about this?
We're all ready. I think what I wanted to kind of highlight, Howard, is kind of what you talked about, that the University of Iowa and Delta Dental, this thing didn't happen on its own. This is a multi-collaborative event that occurred back, almost 11 years ago, that the University of Iowa and Delta Dental said, hey, we see this problem. We need a solution. We just can't sit back. And Deb Hoyle actually has lectures integrated into the curriculum to help students. And Delta Dental has a great presence with their FIND project, which I was a recipient of, that actually, goes above and says this can actually happen. You can make this happen. And this program can work. And it's been working in Iowa for quite some time now.
Why did Delta Dental get involved with this?
Delta Dental is a nonprofit, but I'll let Maren jump in here.
Yep, I was just going to say Delta Dental is a nonprofit, and as part of our mission to give back, we obviously want to have dentists throughout Iowa so that there's access to all throughout the state, and that's part of our social welfare mission. This was a really good chance to stay connected with the dentist. We know that there's a lot of good talent and helping keep them in the state. And also successful, to your point of having multiple dentists in metropolitan areas, this is it's extremely advantageous to go out into rural areas where you might be the only provider and able to have a very successful business.
Plus, I would think if you're going to raise kids, I mean, I'd rather raise kids in a house where you can go out the back door and shoot a .410 shotgun Every time my boys did that in Phoenix, the police were there usually within 15 minutes. I just think it's a great lifestyle. So explain the breadth of the problem. I mean, like how many communities in Iowa today don't even have a dentist?
We actually have 3 counties. We do a lot of looking at things by county versus by community, but we have 3 counties currently in the state that do not have dentists, and we are actively working to recruit dentists to there.
And how many people probably live in these 3 counties, or each one of those counties?
At least 10,000 to each county.
Wow. I mean, that dentist wouldn't have to do much advertising and marketing, would they?
Correct.
10,000 people, and you're the only rodeo in town. I mean, why? And these dentists graduate with $300,000 in student loans, and then they go decide they're going to go down to Des Moines and be the 10th dentist in a medical dental building. And then here's a county with 10,000 people that doesn't even have a dentist. I mean, I just don't get it.
Well, so another partner in the FIND project is Iowa Area Development Group, and they work with and partner with the rural electric cooperatives and independent telecommunications companies in our state. And with their resources that they have available, they're able to help. Can I completely just cut that out? What I just said.
No, you're good.
Part of what they do with their partners is they're very involved in business and community development. And so one of the things that is recognized is that having a strong healthcare infrastructure in a community, not only does it help to attract new business growth, but it also plays a very large part in retaining the existing employers that are currently there. And so they took an interest in collaborating with us on this project, and it started out looking at the matching funds for the loan repayment, but there's also the advantage of they can help connect new dentists to, and even existing dentists to low interest loans through revolving loan funds that exist in different communities in the state. They also are able to help with the application for what comes as a grant to the rural electric cooperative or to the independent telecommunications group, and it passes through as a 0% interest loan to the new dentist. And they're able to use that to buy equipment, to renovate a structure, to help build a structure. And when you're looking at a 0% interest or a really low interest, given the debt load that they're already carrying for the student loans, that can really benefit someone in getting started out in one of these communities.
So you're saying they should get a 0% loan, the max they can borrow, buy all of it, put all of it in Bitcoin, and then 30 days later you'll double your money? Is that what you're saying?
Outside of my area of expertise, but it's not something that's guaranteed, but it's something that they are willing to and interested in helping to try to secure and to help make up the financial package in building or taking over a practice.
Some people say that if rural communities want to have dentists and physicians live in their town, that it starts at the dental schools and medical schools. You have to take students from those small towns. There's a lot of people that say you can't fill up your class with a bunch of city slickers from Des Moines and Council Bluffs and then have them go back to these small towns. Do you see that, or is that not true?
I see a mix, but I have definitely seen in the time since I've been doing this that we are seeing more people who are wanting to practice in a more rural community or outside of a more urban area. In part because they know the advantage of doing so, but also in part because we've been along the way helping to educate them about what are the benefits, not just as a professional, but also personally or for a family to do so. I've also been engaging in working with the communities as well as Iowa Area Development. They're doing that as well, and helping to educate them. And so they are part of the process of recruiting a new dentist to those communities, which also helps people to choose to go that direction.
So what's the biggest city in Iowa and how many people?
Des Moines.
Des Moines, how many people live in Des Moines? 215,000. But you are seeing kids that were born in Des Moines with 215,000, and in your 11 years, seeing some of these kids go out to towns of 2 or 3,000.
So I was born in Nebraska, but my parents have lived in Iowa City, where we are now, and that's about 45 minutes from where I practice and live. And it's a good spot for us. We're close to family. I'm not competing against every other dentist. I would say if I would have gone and tried to open a pediatric dental office in Iowa City, it probably wouldn't have been as successful at where I am now. So I think having a family and you're not going to be out doing the party life when you're opening a dental office and have a family anymore. So being able to travel and do those things on the weekend if you have to, you can definitely make it work in a smaller town.
And you probably know where the sheriff's at all times, right? So you can just avoid him.
I don't know. I see him every day, probably on my drive to work. I don't know.
So what kind of resources are available to these students to go rural? What is the state doing? What is Delta doing? What kind of resources are available?
Yep. So the Find Award is up to 100,000, and that up to 100,000 is made up of a state appropriation that is $25,000. Delta Dental contributes $50,000 per recipient, and then there's a community matching piece that Jarod mentioned, where initially it's a $5,000 investment and can be up to $25,000. And so part of that. The reason we've done that is really to have the community invest in the dentist, and also some skin in the game for the dentist. It's really easy we don't want a dentist to have loan repayment and then get up and leave in 5 years. Obviously, the intent is to stay there and keep providing for that community long after the 5 years. But it's pretty easy to call me in Des Moines area and say, I'm leaving this community, but it's harder to do that once you know your community's invested in you. So that's why there's that requirement of at least the $5,000. Some choose to fundraise above and beyond that. We have one in Southeast Iowa who's she's done all of her fundraising and had over 25,000, I believe. So we say it's an $80,000 award up to 100,000, and a lot of dentists do receive that full 100,000.
And how many $50,000 awards has Delta given to this program over the years?
We've had 43 dentists that are awarded, so that's a little over I think it's 2 million, 2.1. And then, of course, that would be just Delta's funds. And then total, I would have to do the math on that for you with state appropriation, and then it varies based on what the community is given. A lot of times the communities will give a small match year after year for those 5 years. Some people give it all up front. It just kind of depends who the local community partner is. And as Deb mentioned, our partners with Iowa Area Development Group are very successful in helping identify some funds at either local telcos, RACs, folks that understand why it's important to have the business in their hometown and prevent retail leakage.
Now, does the dentist have to be from Iowa or an Iowa dental school, or could some kid listening to this in New Jersey come do this?
Anybody who wants to come and live, it doesn't matter what school you went to. We do have, you had mentioned you went to Creighton. We do have some Creighton grads. I think it's really, the dentists that typically apply for this are more public health minded dentists. They want to serve in these areas. They realize there's underserved folks as well that need help. Part of the requirements, so a lot of times people ask, what's the string attached to this money? And really, it's not any more than what I think a typical dentist is doing. Is we ask for them to be seeing new underserved patients every quarter. We have them do quarterly reports where they just provide us underserved numbers compared to their total patient base. Dr. Johnson can tell you if that's a hard process. I don't believe it is. I haven't had anybody tell me that to this day. And then they collect those numbers so that we can report back to stakeholders, groups like you, as well as our legislators, to say, here's the good work that they're doing throughout Iowa.
Now, if they're listening to this and they want more information, is it the Iowa Find Project? Is that the best website for that?
That is, and that actually gets you access to not only the Find Loan Repayment Project, but as Deb has a fantastic map or section on their website where you can look for practice opportunities. So even if you're just looking to come to a rural part, you can have access through that iowafindproject.com website.
So Deb, I'm looking at your map now.
Yes.
I take it your favorite color is various shades of blue. So talk about that map.
So with that map, it's very interactive. If someone takes the mouse and starts scrolling over the state, or I'm sorry, each county, there are 3 points of information that will pop up in a little box. And one of the things that will pop up with that is whether or not there's an opportunity in the county. Another way to find out if there's an opportunity in the county is there's an overlay that you can click on that will highlight each county that has an opportunity. And then if someone goes ahead and clicks on one of the counties, it will open up into a new page, and there's all kinds of demographic information about that county. It gives insight as to the number of specialists, the number of dentists. It talks about other healthcare entities such as hospitals, physicians in the area. It talks about economic demographics, and so on and so forth. But it also then lists each opportunity that's available in that county, and somebody can click on that link to it to have in another window information about that opportunity appear.
And who built that website?
We built that here at the University of Iowa. I was part of it with the map in particular. We had a programmer from our Public Policy Center who built that, and then the database for the practice opportunities was actually a programmer here in the College of Dentistry. Our web designer helped with the layout here at the college, so it's all us.
Would you agree that programmers became programmers because they didn't have enough personality to become an accountant?
I don't know. I haven't had that conversation with them. I think it would be really great to work with myself.
I mean, that's something that all 50 states should have. I always thought it was silly that even like the big suppliers like Henry Schein or Patterson, you would think it'd be in their best interest to have all the demographics, so you wouldn't want to sell some kid $100,000 of dental equipment and have him end up in your 30, 60, 90 account receivables because you put him in an overcrowded, saturated area. I always thought the American Dental Association should have done this 30 years ago, but you guys did it for the state of Iowa. Are you familiar with any other states that have a website this sophisticated?
I would love to tell you that there are. However, no, we're the only one that's taken it to this level.
I mean, that is just amazing. I mean, I wonder if you could get deltas in all 50 states. How many different deltas are there now?
Oh, they're statewide. I would have to check.
I mean, there's like
43?
43?
Maybe. I would need to check on that for you.
I mean, that maybe that's a program where you can get the 43 deltas to start implementing this program, because it's just a win-win. It's a win for the dentist. It's a win for the community. It's a win for everybody. I mean, it's in nobody's best interest to have a bunch of highly competitive dental zones where dentists aren't paying their bills, and I mean, it's not a win for anyone.
Right. There are some other deltas. Delta Dental of South Dakota comes to mind, right top of mind. Everyone in Minnesota is looking to do a similar program. Everyone operates them a little bit differently. So ours, we really like this collaboration piece just because there's a lot of folks that are in the game, and it's really trying to help the dentist be most successful.
Yeah, on the Delta website it says there's 39 Delta dental companies. 39. And it's funny because people always talk about Delta like it's like McDonald's, like everyone's the same. I mean, they dentists talk about like Delta Dental is just like this one insurance company, and it's really 39 different companies.
Yeah, there's different member companies. We provide care and benefits to Iowa-based companies while we still have that name at Delta Dental of Iowa. Delta Dental of Washington might be serving a different population. We operate foundations completely different, but we do share ideas. Yeah.
So Deb, what's your when do dental students start thinking about things like this? Are they thinking about this freshman year, or is this a last minute freak out senior year of dental school and they realize they're about to graduate and they have no idea what they're going to do? When do they start getting interested in this?
Through the years, I've seen some change with this as well. I encourage students to start thinking about it their very first year that they're starting, because it's a process, and it's a process that takes time if you want to essentially end up on the right path for yourself. So I do have freshmen that will come in to start talking about down the road and connecting them to dentists who are practicing in the state that as mentors. And then I usually see an uptick in the junior year. I'm seeing more and more juniors come in than I used to see. And in January each year, they get a community analysis project, which part of that project is choosing a community that they might have an interest in practicing in and analyzing it to see, can it support another dentist? And so that will, if they haven't thought about it before, that will usually start to spark that idea of starting to look and start initiating conversations, not only with me, but with dentists and with communities. So that hopefully by the end of their 4th year, it's all been decided and secured for them.
So, Jarod, talk about your article. You wrote an article in November Dental Town magazine called The Loan Arrangers by Dr. Jarod Johnson. Talk about that call, and thanks so much for writing that for us.
Yeah, great for Muscatine and featuring our community. I think it got a lot of buzz going around town, so we really appreciate it. But I was a recipient of the FIND project, and it's made a big impact on my practice and the patients that I see and the families and their lives, and I just wanted to put this out there for everyone to see the collaboration that happens. And this project, it's taken a lot of work. You got all these partners. You got University of Iowa, Delta Dental. You have my community contribution from the Muscatine Health Support Foundation. It's just all these pieces coming together is such a great thing. Why are we not doing this everywhere? I mean, you have the ADA, they've got that action on people going to the emergency room, and what are they going to do there for a toothache? This is the kind of population that this can help get those people out of the emergency room, get them their care, and it also benefits the community. Having dentists and providers, quality health care in a community keeps those people in town. It keeps employers, there, and it also can help prevent money from going out of the community. If you go up and have your dental visit in Iowa City and have to go up there, you're going to be buying gas. You're probably going to stop at the store and buy groceries. You're probably going to buy a bite. That's all money that left your community. So if you can have that stay there and maybe even bring some people from the surrounding area to come to your community and give those other businesses an opportunity to have people buy gas, eat food, get their groceries before they leave, that can provide opportunity for other businesses. My office is right across from the Dairy Queen. I bet they're the happiest people that kids dentist went across the street because everyone's taking their kid over there for an ice cream cone afterwards. But it's just little things like that you don't think about. For our small communities can have a big impact, not just our dental care, which is important, but there's other aspects to this project that I think, need to be highlighted.
It is a black eye to dentistry when you look at the data that shows 8% of emergency room visits are tooth odontogenic in origin. I mean, what does that say to a country when 8 out of every 100 people that go to the emergency room is for a toothache? And I also think it's very bizarre. I could go in the emergency room and they could do a bypass, they could remove a brain tumor, fix a broken leg, but they can't fix a tooth. I just think that's weird that they could remove my gallbladder but not my wisdom tooth. Isn't that
Yeah. I think it's a challenging problem, and I know as dentists now we're facing all this opioid crisis, but what do they do when they go to the emergency room? They give them an antibiotic and they give them an opioid. So we're kind of training these patients, to have that habit when they come to us. So I think if everyone did their share and, maybe saw a few of these underserved patients and took care of them in our office rather than having a big bill for our taxpayers.
Is the opioid a crisis in Iowa too? I mean, is that an epidemic in Iowa?
Yeah, we've got just Iowa Dental Association just came out with a blog post recently on it. It's a big problem.
Yeah, it's always something. I mean, it's a meth crisis or it's an opioid. It seems like when you start to deal with one drug, another one pops up. Now what are they adding fentanyl to these opioids? So it's no longer just OxyContin or hydrocodone or oxycodone. Now it's with fentanyl. That's it's amazing. And then to see some of these celebrities when their toxicology report comes back, I mean, they're like a mini pharmacy inside them.
But if we can take care of these patients through programs like these, we can. I'm sure most dentists can take out a tooth. But it's not always. Maybe it's hard for, like pulling teeth. But I think. That'd be a good service if we. I
want to talk about another issue. There's no way I can have a pediatric dentist on the program without talking about the 400,000-pound elephant in the room, which is silver diamine fluoride. It seems like here in Arizona, we just lost a 3-year-old child last week, being put to sleep for dentistry, and of course she didn't wake up. And 3 years ago there was another little girl right up the street from where I live. What is your thoughts on silver diamine fluoride? Because some people say a lot of these kids being put to sleep, you could have just painted silver diamine fluoride on their cavity every 6 months. What is your thoughts on silver diamine fluoride, and are you doing it?
Yes, I do it. I think in pediatric dentistry we're kind of heading a few different ways. One is on the treatment of the cavity, and we have things like Hall crowns and silver diamine fluoride, which aren't as aesthetic in nature, but they can avoid some things such as sedation. And then we also have the parental concerns about behavior, and they don't want their child to have a bad experience, but then they also want their child to have a white tooth. And all these things can't always come together. Yeah, we'd ideally like your child to sit there open, not move, but it's not always possible. And some of these kids that I'm seeing are coming to me with 12 cavities, and silver diamine fluoride won't work on everything. It'll work on smaller stuff, but in my experience, I was using it quite a bit a few years ago, back when we did the other podcast, and I had one kid come in. I was treating us. I thought it was a small occlusal lesion on a tooth, came in with a huge cellulitis a few months after we started the treatment, and that was the kind of time where, I kind of realized maybe I shouldn't be. You got to kind of use case selection, and not every case is a case for it. So that child ended up needing sedation to get the tooth removed. So you can't always stop it. If we're painting this on teeth that are dead, it's not going to do anything. The infection's still going to be there at the end of the root. So there's limitations to everything. I think it's a great tool for us as pediatric dentists to have in our toolbox. I do a lot of alternative techniques to try to avoid sedation. It's probably one of the scariest things that I do is, when we go to the hospital, they have great providers, but, things don't always go the way we want. And I think we've had quite a bit of publicity on sedation deaths within the last year, more than enough to make any provider have a little concern.
Well, Facebook has really changed that, because these cases used to go on, but they didn't make the news, or it was a local play. But now a story like that can go viral on Facebook. And, someone can post on Facebook, and next thing you know, 1 million people read it.
I think it's for dentists. I think we're treated a little differently than a medical provider. There's kids that undergo, surgical procedures every day. Anesthesia is very safe, but we don't really hear about if something happens when someone has tubes put in, or, has the tonsils removed, things like that. I think sedation can be safe, and there's safe ways to do it, but anytime we do something, there's always risk to it.
And the dentist is always the bad guy, and the journalist never asks the question, Mom, how did your 3-year-old have 12 cavities? And, Mom's standing there with a Mountain Dew in her hand. It's like, what city are you in, Jarod?
I'm in Muscatine, Iowa.
Muscatine, Iowa. Well, how would you describe the decay rate there?
So I think I see about 70% Medicaid in my office right now. I started about 2 years ago. I take Illinois and Iowa Medicaid. I get a lot of referrals, people coming to me, 3 hours away in Illinois. And there's a lot of decay, the 80-20 rule, 20% of the kids have 80% of the decay, and that's what I see. And
do you think it's more diet or home care, or what do you think it?
I think it's a combination of everything, how well they take care of their teeth, and what they eat. We can't always, control. Kids don't get to buy the groceries, as I always say. They'll eat what their parents buy and what grandma and grandpa buy too, and that can be part of the problem as well.
It was a law of unintended consequences in the China policy of 1 child per family. I met the first pediatric dentist who opened in Iowa. I also met the first one in New Delhi. But basically, think about that. You only have one child, so mom and dad are spoiling it. And then each parent has a grandma and grandpa. So you actually have 6 adults spoiling this little kid. And these Chinese people, the candy, the American candy and Coke, it's all a new thing. And they would bring their kids into the dentist shocked, like, why, mom and dad never had a cavity, grandma and grandpa never had a cavity, and now this kid's got 12 cavities, and they're having to learn the hard way that Hershey's chocolate and Coca-Cola is, it's a big new deal in China.
And it's like you said, it's a preventable disease, and Delta Dental is actually doing a lot of things outside of the FIND project that are relating to prevention. Maren approached me about trying to look up for the next cycle to have, the water stations. You can get those installed for people to fill their water bottles. They've got a grant for people to install those in the schools. So high schoolers and then middle schoolers are choosing healthier drinks, water rather than, the Gatorade and all that kind of thing. So Delta Dental's been on top. They also have a program for getting children into the dentist by age 1. So maybe we can catch some of these things and educate the parents that all these things that you just talked about are not the greatest things for our teeth.
So is it safe to say that you're using less silver diamine fluoride today than you were 2 years ago?
I'm doing a lot more Hall crowns and.
Explain what a Hall crown is.
Well, I posted a little case on the Pediatric Dentistry forum. I call it socks on a rooster. It's a technique where it's from England. Norna Hall invented it. Basically, it's taking a stainless steel crown and cementing it on tooth without doing any anesthesia, without doing any drilling to the tooth. And what that does, if it's small enough and the tooth's not already dead or inflamed, it'll stop the cavity from getting sugar and stop it from growing. That's a technique that we use quite a bit on 2 and 3 year olds that we don't want to do sedation on, because obviously there's risk to that, and for one tooth maybe that's not worth it to put a kid under. In my mind, I would do this for my child. So technique is I'll usually put in dental separators, orthodontic separators, and then 2 days later have the kid come back and fit the best crown I can, and off we go.
So Maren, is there a code for silver diamine fluoride, and is Delta of Iowa seeing more people using it or less? What's silver diamine fluoride look like from your end?
I know that we just started covering that as of this year. Since my job is primarily in the foundation, I would be happy to refer you to the folks. I don't know about frequency of use for that code. I do know that in the past year and a half, we've had our provider relations team has brought in Dr. Jeremy Horst, which I'm sure you've had on your podcast before, who's one of the experts and researchers behind silver diamine fluoride, and providing opportunities for other providers to learn about that and feel comfortable using it in their offices. But I would need to get that information for you, since I don't know off top of mind.
Well, Jarod, what do you think? Do you think it's a fad that's growing, flat, shrinking? Where do you see the silver diamine?
I think right now we're growing. I don't think we have all the information that we need to figure out what it's going to work on and what it won't work on. But if it doesn't work, we still have traditional dentistry and traditional means to take care of the problem. So I see it as another tool in a dentist toolbox to use. It's great that we're starting to see some reimbursement from insurance companies that helps patients with patient treatment acceptance, and definitely with the sedation risk and things. I think it's a trend that we're going to continue to see to grow, and once we know how it works, I think there'll be a perfect fit for it in dentistry.
And you know how you said 20% of the kids have 80% of the cavities? I still think we're at a, when HIV came out, the entire planet learned almost overnight that STDs are real, and you can, when I was little, it was mostly they were afraid of getting pregnant, but with AIDS, the whole world understood STDs. But back to the other end, the mouth, I still think decay is like a oral communicable disease. When I see these kids with 10, 14 cavities, mom's got bombed out teeth, dad has bombed out teeth, grandma's got gum disease, and they're all kissing each other, and they're all sharing utensils, and they all live together. I think that you have to, in order to stop because there's plenty of kids who have horrible diets, without any decay. We've all seen these kids. I think it's you got to go in and treat the whole family. I mean, if mom's kissing you 3 times a day and she's got 6 billion streptococcus mutans in every kiss that she gives you, this kid doesn't have a chance. And so I see it as a family disease.
I think Dr. Johnson had pointed out the Dentist by One program, and that's something we are trying to speak with families and get them this information early on. With the Dentist by One program, not only are we trying to help remind parents and caregivers to take their child to the dentist by age 1, but also to your point on sharing utensils and that you can pass cavity-causing bacteria back and forth. So that's one of the points to that too. Trying to get that message early, and of course not going to bed with juice in a bottle, things that dentists know to tell their patients. But that is something we try to do and instill early before those habits are formed. I don't know how I'm going to get moms to stop kissing babies. That's too hard.
But back to my HIV point, I don't even think grandma or grandpa, I don't even think they realize it's a concept.
Yeah.
That
right.
Grandma's, she's lost half her teeth, she wears a partial, she's got a gum disease, she hasn't been to the dentist in 5 years, and she doesn't realize that those kisses, I think a standard grandma kiss is like 80 million bacteria, funguses, viruses, parasites being transferred. I mean, 70 million just for, a quick kiss. And every time you have that baby, they're just passing that baby around the family, and grandma's kissing it, and everybody's kissing this baby. And it's that environment where everybody in the family has multiple cavities.
And back to your point, Howard, I think some of that you were talking about the silver diamond fluoride, and how many of these parents and grandparents I have, they're parents of the children in my chair, that they say, I don't want them to have the same experience that I had when I was a kid. And maybe they don't go to the dentist because we didn't offer something in a comfortable way. And we can't always do that given the infection or the pain that the child's having, but we want to try to and make things so maybe we can flip some of that, being scared of the dentist or intimidated from the dentist. Maybe we can provide better experiences with some of these alternative techniques, and maybe sedation is necessary to provide them a comfortable experience. Every kid's different. And that's our main goal, is to have a child infection-free and also be happy.
What's the status of water fluoridation in the state of Iowa?
Water fluoridation, we're just at about 90% of community water systems, which we're very happy with. There has been some rollback with equipment as equipment starts to get older. A lot of it was installed in the 80s through some funding that was provided, and now that needs to be replaced or updated. So we are trying to maintain that. The foundation works with the Iowa Public Health Association, strongly have a great partnership actually, and we offer some grant funding to communities who need updated equipment and provide funds to be able to do that so that they can continue providing optimally fluoridated water for their residents. The other part of that, with instilling good oral health behaviors, drinking tap water, that's good for you. As Jarod mentioned, the Rethink Your Drink program that we've launched this past year, helping schools, especially schools with older drinking fountains, have those updated. And then we provided refillable bottles and toothbrushes for students and teachers in those classrooms so that they can remember to be drinking water throughout the day, not have those sugar-sweetened beverages, Gatorade, things like that. Those complement a lot of other efforts going on in the state to be 5 fruits and vegetables, healthy food, drinking water. So that's something, we're fortunate to have such a high fluoridation, optimally fluoridated state compared to some others.
I worked on the original fluoride campaign in Arizona in 1989. And then the way they set it up, it expired. It went into sunset after 20 years, so we had to do it again. And I still can't get a gauge on what percent of Arizona is against it. I mean, we got it in 89, and again just a few years ago. But is it just what's it like in Iowa? Is it just a vocal minority against water fluoridation, or do you think there's what do you think the pushback is on water fluoridation?
I think we've been pretty good in the state. Part of that's educating our communities on the benefits of that. So that involves, we can do that from the state level with the Department of Public Health. They're very involved. The Iowa Dental Association, of course, all the providers. So Dr. Johnson, I know, will be communicating with parents on why it's important to drink tap water and optimally fluoridated water and why that's a benefit. So I think right now we've had some, pretty success. There hasn't been a lot of vocal pushback right now. I think part of that, a lot of that, it's in talking about it and being proactive, and especially credit to our providers for talking about it while they're seeing patients, and even healthcare providers, we try to share that message with them too.
Man, and it all went south when Senator Joseph McCarthy went on the House floor with a diagram of the human brain where there was a red dot where he said that's the area that when you drink optimally fluoridated water, it makes you more susceptible to communist ideology. And it's like, wow. And we're still fighting that 40 years later. Isn't that just amazing?
Yeah. It's incredible.
Yeah, there's just a lot of crazy people. I don't know what percent of Americans are completely crazy, but I still think they need to do a movie on the. Did you guys ever hear about the story of when Grand Rapids became the first city in America to fluoridate? I think it was January 20th, 1945, something like that. Did you ever hear the story of the first day?
No.
It was the most genius story. This guy knew that people were crazy. I mean, so what he did. He would start hearing rumbling, So what he did is they announced that Monday morning that, they would start fluoridating. And just like he knew, people were having anaphylactic shock and going to emergency rooms and fainting. And he didn't say a word. And people were calling his office saying, you need to reply to this. He just laid low. It got even worse day 2. Finally, day 3, the governor and everybody's like, you have to do a press conference. You have to address these concerns. He walks out there and says, I knew this would happen. That's why we didn't turn it on. We're gonna go ahead and turn it on tomorrow. So all this 3 days of chaos and noise, you're crazy. And we're going to start water fluoridation Thursday. Is that just the most classic story ever from a dentist in public health? I mean, I just think that's one of the greatest water fluoridation stories ever. So people listening to you right now, who's a good candidate? Who should go to Iowa Fine Project? What is an ideal candidate?
I think somebody very much public health minded, somebody who wants to live in a rural area. As I mentioned, we want, our intent is that the dentist will stay there for well beyond the years of loan repayment. But I think it's somebody who enjoys a sense of community, somebody just like Dr. Johnson, actually. And he's probably not going to tell you himself, so I'll brag for him. But he had an open house last year that I went to. And I think part of this, he's still a very young dentist, but he's been able to use his successes and already turning around and giving back to his community. And he can probably share a little bit more about the community fund that he's starting to help kids in his community. But I don't know that he would be able to do that or feel confident. I know that he still has a great amount of debt that you have to pay back student loans and business. I understand that takes money, but partially because of loan repayment and how the community's invested, he's already turned around and is doing philanthropic work in his community. So that, of course, is good for a strong candidate, somebody obviously who loves dentistry, but I think just likes that lifestyle. In Iowa, we're pretty close, and Deb has better numbers than I do, but you're pretty close to any major highway and interstate. You're just a short drive from the big city, so that doesn't seem to deter folks.
And plus, that drive is going to go away because with driverless cars literally around the corner, it's going to change the whole automobile. When you look at, I think last year the United States sold 17 million cars. Average price is $35,000 a car. Most of that cost is for the pilot to be in there steering and all that stuff. They're really going to turn into just a box with just a battery-powered engine. So if you have an hour commute, your box could be, you could just go sit at a desk and do your email. It could just be a bed. You could just, when your alarm clock goes off, you could just go lay down in your bed and take another hour nap on the way to work. So I think when driverless cars, and I think people are going to like the community, because imagine you're trying to work from home and you got a spouse and kids, daddy, that's all. And then when you go to work, people, all those time destroyers that go from cubicle to cubicle to cubicle. Hey, what are you doing? What's up with you? How was your weekend? It's like, God, you can't get anything done at home or at work. So if you had an hour commute and you just got inside your little box, sat at your desk, and had 1 hour of interrupted time to do your email and all that kind of stuff, then you could go to work, you could have your team meetings and all that kind of stuff, but then you would look forward to your commute home. And then by the time you did all your work on the commute home, then when you came in, you could unplug and so I think driverless cars are going to push a lot of urban people 1 or 2 hours out into the suburbs. What I'm trying to say.
Interesting. They have time to listen to the podcast then.
Yeah, it'll be good for my my podcast. I'll sell more free episodes. So, Jarod, are you married with kids?
Yep, I have 2 little ones and a wife.
Now, on the wife, did you find her in the big city, Des Moines, and take her urban, or did you go rural, single, and find a rural girl and marry her there?
Actually, I kind of did both. So we met here at the University of Iowa. She actually worked here, and we got married here. And then I drug her out to Las Vegas for my residency. So we took her, to the urban area, and then I drug her back out to the rural area. Their families are from Iowa City, so we're about 45 minutes away.
But so she grew up in a bigger city, 45 minutes away. But how is she like the rural life?
So we get to see our family quite a bit, so that's good to be close. And then she also works right now at Han or HNI, so she's got a great job in the community there, and wonderful place to raise our kids.
Yeah, I love the rural life. I just think it's great. So, is there anything I missed that we should talk about, or did we pretty much cover it all? Or
Yeah, I think one thing that would be good for people to know is it is possible to replicate what we have done here in Iowa, and that any of us, whether it's talking to Maren, talking to myself, talking to our partners at Iowa Area Development Group, we are happy to help people learn about how we've done things here and how they can think outside of the box in their own state and own community to make things happen. And along that line, coming probably by February, there will be a new page added to our website here that will have a community recruitment guide. A lot of economic development groups, they know how to do the recruiting of big business and what have you, and it's not necessarily dissimilar, but there are nuances in recruiting a new dentist that they maybe aren't aware of. And so by creating this guide, it will be something that other communities, other schools, what have you, will be able to use, and like I said, then they'll be able to replicate this in their own areas.
So I would, on that Iowa Find project, I would have that programmer go back and add some share buttons, so you could just forward that on Facebook, Twitter, LinkedIn, Google Plus, Pinterest, Instagram. Because I think what you've done is amazing, and if those, like, I would retweet it right now. I would share it all over social media, but I really wish the word would get out. Like, say there's, if every state did this, the citizens would come out ahead, the dentists would come out ahead, you wouldn't have oversaturated areas and undersaturated areas, and might start taking a dent in that 8% of the emergency room visits, odontogenic in origin. I think what you've done is just amazing, and I want to thank you so much for coming on the show. I know you guys are busy, and to come on the show and talk about this for an hour is outstanding, and let us know anything we can do to help spread your word.
Thank you for having us.
It was an honor. And Jarod, don't be drinking that silver diamine fluoride.
Well, it will stain my teeth. I want to have white teeth.
Thank you so much for coming on the show today and talking all things public health, dentistry, Iowa, Delta Dental. Thank you so much, everyone.